Hello there, guys, and welcome to the next episode of Let's Play Project Hospital. Sorry, if you missed me, I'm right there. So, we are going to do what we've been doing so far in our mega hospital. We have a huge hospital now. We have over 300 in staff. More than 100 people are coming in regularly every day. Right now, I think 130 something. Normally, I think 100, above 100, between 110 and 120. But today, I think they have like an extra, like 15% coming in from whatever. So I think it was almost 140. But our hospital is still, in some aspects, it's still a little bit basic. But as you can see, we have, just if you are new here, we have the clinics, we have different departments. This is the morgue, it's the worst stuff, already all running. We still have this empty space here, which we will have to figure out what to do, what kind of lab or radiology or whatever is going to go there. And the fourth floor is what actually kind of empty. We're going to have the infectious disease and, well, let's see what else is needed. Actually, we might need to put just some general, like just putting a lot of wards, for example. I don't know. Let's see. I don't know, but as you can see, we have 303 staff already, and it's probably going to grow even today, because once we realize that there are some bottlenecks, we always adjust. So let's actually quickly take a look if anything is critical right now, and radiology is always critical. You see, it's the middle of the night, workload at the night, critical. 6 of them are critical. So it is a busy day, busy time over there. Other departments seem to be all good. I'm also looking at the on-call rooms and everything to make sure that they are, yeah, they are, everywhere is dealing with, well, oh, well, pathology is a little bit busy. Well, no, actually, I'm not sure if it's pathology. I think that critical was the pharmacy. The pharmacy were kind of complaining that they have too much to work. Now, before we do anything, I just want to quickly take a look at here. What is the status of the workload night critical? Workload day critical. I cannot see anything. Workload night critical, workload day critical. Yeah, so these places are busy, that's for sure. High and critical, basically. Although here workload night is low, so I don't know how they actually do that, to be honest. Like how they differentiate, I don't know. Like why some of them daytime busy, some of them nighttime busy. And also let's take a look at these. High, medium, there is one that is critical at night, which is my CAG room, where you get like what do you get in CAG? Um, kind of forgot. That's okay. We're gonna see it. Uh, okay. X-rays are critical all around. Although here it says medium, so some of them, okay, critical. Look at that. These are critical as well. Medium and high, and this one is critical, which is weird. And this one is empty somehow. So I have a feeling that maybe I have some doctors who are just not there, who are not doing their job properly. But take a look at what she's doing right now. Oh, she's doing first aid to somebody because people are, unfortunately, collapsing left and right. So, yeah. So I don't know. We must do something about it, although so far it works okay. Obviously, we just started the day 60 minutes ago, so right now the prestige is very low. It normally starts like that and goes up pretty quickly. But other than that, we are fine, I guess. So let's quickly just take a look who is waiting for the player because now we are controlling everything. Going to doctor, exam, waiting for player. Okay, Margaret. Now let's get rid of everybody else. Hold on. Gonna get rid of everybody else. So Margaret is waiting for the player. Who else? This one not, this one not. I don't. Okay, let me see if there is anything hospitalized. Waiting for free examination room. Okay, that's a lot. Look at that. They are looking for free examination room. I want to check it out. What do I want? X-ray. Yeah, the X-ray is kind of busy. I told them to do an X-ray, so urgent echo. Okay. We have to pay attention to these signs, waiting for free examination room, because that can be a problem sometimes. Now we're gonna get rid of these. And let's see, anything else that's waiting for us? No. Waiting for the player? No. Waiting for the player? No. I don't see any waiting for the player. Somebody is just waiting there. That's fine, but there's only one. So when it's, last time I went through very carefully over the clinics. Like this is cardiology. Look at this. 1, 2, 3, 4, 5, 6, 7. 6 people are in the clinic, but I actually filled it up. So we have 3 doctors for them. That should be more than enough. No feeling too good. What? This is the first time I see something like that. So the status is Robert Clark is no feeling too good. Oh, yeah, I would say so. He has a heart failure. He's not collapsing yet. Where is he? Yeah, I would say. Okay, I'm gonna actually treat this patient with the same priority as critical patients. Okay, so I'm gonna put it on. I don't know if it makes any difference. That's the problem. Like, is anybody gonna take care of him? And whatever happens, I'm already gonna. He already needs defibrillation. Okay. So let's see what happens to him. But other than that, there is no waiting for the player. This is the first time I see this. No feeling too good. Huh. That's an interesting English itself, but whatever. Treated. Okay. All right. So actually, I'm gonna keep it on him right now. But first, let's see what you need. Waiting for the player. I'm gonna open this one and I'm gonna close this one. All right. She's just a chronic fatigue syndrome. We still have some. Okay, we haven't even done a physical. Do we need it? He's not getting any pain medicine, I believe. So, oral cavity, but it doesn't even, oh, we already did the oral cavity. Yeah, physical, we haven't. It would just give him some rest, but he's already getting that anyway. Physical would give him recommendations. Okay, let's go back here first. Where is she? She's already in the office. Okay, that's good. You know what? Then why not? No need for that. Interview. Yeah, let's give him a physical. Let's give her a physical just in case. And let's go back here to our friend who no feeling so good. And let's start in day 101 actually. Let's see. Okay, so now he's collapsing. Okay, yeah, that was quick. That was quick. He's like, no feeling so good. Like that. That's interesting. Anyway, sorry about you, my friend. Well, you're gonna get some defibrillation and everything, but there is really nothing. And you should get some TC hospitalization. I think they're gonna do that automatically. I'm not sure. All right, let's see how it works. Actually, I'm gonna keep it because okay, Frank Thomas, we're gonna take a look. You had angle closure glaucoma. You already had an eye surgery. You already got everything what you needed. Um, actually, you know what? I'm gonna give you some stomach, all the other stuff so that you feel even better and just go on. Okay, here you go. Somebody is treating him and puts TC hospitalization automatically. Okay, that's good. All right, so we're gonna get back to him, I believe. We don't need to worry about it. He's gonna be in the TC hospital. So let's go to Margaret Martin. You just got some physical and speeches, and you got some antidepressants coming for you. Physical didn't show anything, so I think we're pretty all right. I don't think we can do anything else. Physical we did. Speech listening we don't need. We already know that you are depressed. Evaluation to just give you some recommendations what you already get. Yeah, I think it's fine. So let's just actually I'm thinking just let her treat him. Let's I think we figured out everything, so let her just treat her. There you go, and you get everything what you need. Let me see if you really get everything what you need. You got the antidepressant. Yeah, you don't need to worry about that. You know what? Let's give him some rest as well. All right, Christopher King, what do you have? Okay, that is bad. Helicobacter pylori is a bacteria present in the upper gastrointestinal tract. It is the main cause of peptic ulcers. Oh, that doesn't sound so good. So he got vitamin supplementation. He is getting everything. I mean, he's gonna be just good. We don't have to worry about him. He is in the ICU. I believe in the morning he's gonna get out of the ICU. So good for you, sir. Let's go for the next one. Okay, so basically she's got treated. Everything is okay. We don't need anything else. So you can go home. Thank you. And you paid 480 to us. That's good. Back to the back to this, it used to be for a while we did that. I've seen every time somebody left, I could see popping out how much money you give us and everything. And that kind of missing already. So now we are doing it again. So I like it. Okay, Frank Baker, what do you have? Pulmonary NTMB infection, which is microbacterial infection of non-tuberculosis type of disease caused by other species of microbacterium is relatively common. Often, okay, so it's not a big deal. But it's 1,350 dollars. Okay. So he has MAC. What is MAC? So the PCR, was it a PCR testing? Yeah. Or this one? No, I think it was the long and this one. Okay, so we cannot really do anything about that. Coughing of blood, and we cannot do anything about it. It's kind of bad, if you ask me. Okay, but we're gonna give you some NSAIDs, and pretty much that's it. Is there anything else we can do for you? Uh, we should. We don't need the CRP anymore because you're already getting the NSAIDs. Okay, for this, that's what it would do. CBC sampling. Why would I do that? I really don't think I need a CBC testing here. We already know what your problem is. You just basically take a rest and you're good. Okay. I believe we have a hospital. Oh, why is it so dirty here, people? Okay, let's see how many people are taking care of cleaning here because it's dirty. Wait, am I supposed to clean this area too? Because to be honest, it's dirty. I'm not sure. Am I supposed to clean that area? Because I couldn't build outside there, especially because of the lights and everything. But it is dirty. So what am I going to do with this dirt? Hold on, let's take a look at it. Because I think we have a little bit under... Let's actually take a quick look everywhere. How many people are responsible for cleaning here? We probably have to increase that everywhere. We have enough money, we just want to... Wait. Okay, so there are two people. Okay, I need one more at night. Thank you. Is there anybody who is a night owl? He's just slow, but actually quite good. And quite expensive too, so I don't want. Okay, you're the cheap. Okay, now that's interesting. Efficiency and dexterity is 0. But at the same time can clean floors much faster. Are you serious? Okay, let's have this one. She's not going to level up quickly, that's the problem. So once she's slow, she's always going to be slow. How about this one? She's more like an early bird. All of these are pretty bad. I definitely don't want that one. I'm going to get this one. All right. So let's do that. What are the other departments cleaning people doing? I want to make sure that we have enough. We have clean places here. Look at that. There is nobody at night. That's gonna be really bad, man. So let's do something here. Okay, he is kind of slow too, but that's fine. Let's have 2 cleaners at night because actually they are very busy at night, so it makes sense. This one is not so bad and not so expensive. All right. Labs. How many cleaners we have? Oh, actually we have 2 cleaners at night. I think that's gonna be enough for now. Here on the ICU, which is on here. Oh, look at that. We're almost full with ICU patients. We have to be careful about that. So we probably need more doctors and everything here as well. Okay, cleaners. We only have 1 set of cleaners. That's not a lot. I'm not sure if we maybe should like extend that, get more, 1 more cleaning group going there. Wait a minute, are you serious? You don't have oh, you have a toilet. Scared me. Okay. So that should be okay for now. That's fine. How many cleaners do you have here? 2 and... Okay, that's not a lot. This is why you are so dirty. Okay, let's just get more. Night owl, okay, you're good. For the daytime and early... Oh, that would have been better, but that's okay. This one sucks for the daytime, but very cheap. Okay, let's just go cheaply right now. And we can actually train them later if we really want to. Anybody else who is working here? Where is the cleaner? Where are the cleaners? Here. Okay, there should be enough. And we're gonna go for Wikipedia there. Oh no, hold on. Actually, no. Orthopedia, we need more. Okay, so we need this person is a night owl, but he's also depressed. We don't want a depressed person here. Okay, for the night, we're just gonna have this person is cheap. For the day, we're just gonna have. Let's have this cheap one. That's fine. And here we have how many people? Look at that. Not really. Okay. Oh no, we need more. Let's just have. Look at that. We already have 310 people working for us. Holy crap. That's a lot. Okay, you can. For the day, let's have a good one, and for the night, we're gonna have the lousy one. All right. And here, we have one at night, one in the daytime. All right. For now, that's it. Let's go back and let's see what's wrong with you. You have an arm contusion problem. Okay, so we're just gonna ask the doctor to take care of you. Okay? We really don't need to do anything more with you. Frank Thomas, he got his recommendations. He's sleeping. We just let him sleep. There is nothing else we need to do. He already had an eye surgery. Everything is good. Okay. Frank Baker, back to Frank Baker here. He got his NSAIDs, so everything is, well, we cannot do anything about the coughing up blood, which is bad, but really nothing we can do, so we're just gonna let him sleep. Thomas Wright. We have 143 patients expected today, so we're gonna be really busy. Okay, so you actually finished the thrombolytics. You can go home actually. Let's see. He has low. You know what? I'm gonna give him some analgesics so that he feels better. And then he can go home. There you go. Now he doesn't have any pain. He's not so happy. But I think he's good. Okay, Jennifer Clark, we're gonna come back to you in a second, sir. Finish the recommendations, hospitalized. He got the surgery already. Yeah. She's taken care of. We don't have to do anything with her. Night is normally a little bit more, not as busy. Night is easier. Fraser Allen, you got basically, you didn't get anything for the anti-inflammatory cream. But that's right, I think. That's okay. You have a lot of patients. We have a lot of patients here. So we have to get rid of them. Everything is basic. You got whatever you needed. So you just go home. Nice. That's a lot of money. Thomas Wright, back to you. So now you got your, we just gave you some analgesics, I believe. So now he's fairly all right. He can go home as well. 1,400. Wow, that's a lot of money. So these patients are making cash here. Okay, so everything is done basically. We know everything what's your problem is, but in the hospital I'm not gonna I'm gonna keep treating them all the way. Now what I'm gonna do is he of course gets his basic stuff, endocarditis, and he is already getting the antibiotics, so that's fine. Fever, we're gonna give him that for sure. Fatigue, because I'm not sure I want to give everything to everybody because that takes a lot of time, and our doctor's time is quite limited. So I'm just gonna give them basically. Why is he so unhappy though? Short, a rough night, need critical, bored, and hungry. Okay, so breathing problem. Of course, you're gonna get that. We got petechia. You need the NSAIDs. Actually, you don't need it. I don't want to give more than I need to. I'm going to start treating the hospital patients like other patients in the clinic, okay? CR, or should I? Yeah, I will, because I don't want the doctors to spend too much time. They are too busy already. So you're gonna have some bronchodilators for your, yeah, muscle and joint. You need some rest. Fine. Fatigue and fever. That's it. That's all you need. Everything that is low, you basically, you deal with it. Okay? Joseph Johnson. Okay, severe frostbite on leg. Everything is treated. Less was the rest, so I don't think we can do anything with you. So just sleep. That's fine. Okay, Susan Garcia. She is collapsing though. She got a heart failure, for which we, of course, we have a defibrillation. Let's also give her some analgesics. And at the same time, let's treat her with that first, and then once she is okay, then we're gonna check out why you are sick actually. Now, here's the thing. We finished the urgent echo, showed nothing. So we still don't know what's wrong with you. You either belong to general surgery or internal. So let's see what we can do for you. We have done a physical. We have done the abdominal palpation. We haven't done a blood test. Okay, we should check out if there is anything dangerous here, and I think there is. Oh, the ECG we done. Okay, good. Physical, obviously we done. All right, so nothing is gonna kill you now. Echo, we did an urgent echo, that's right. All right, we need an elastase test. Okay, it seems that that's the most urgent. Basically, we want to do anything that can kill you or give you some real problem. And apparently, physical, yeah, nothing else is giving you. I don't know what is the exact order of these things. I don't want to see every single one of them, to be honest. I hope that what they are doing is just showing, yeah, elastase test, we have to do that. So let's do that. Okay, let's do that. Anything else right now? Why don't we just do a blood draw as well while you are at it? Takes a little bit more time to get any information, but that's good. So we are down 1 hour. That's good. We already have an autosave right now. We have 7 patients treated. So far, nobody left. Good. 312 people working, and we are down at 69%. Oh gosh, that's really not so good. We have to kind of pick up our numbers, otherwise this day is not going to be nice. Rachel Davis, what's wrong with you? Copperhead snakebite, okay, that's clear. What is that we don't know about you? Physical would show you, no, that's interview. Blood pressure we've done already, and you don't have any problem with there. Physical would do nothing, and evaluation would do nothing either. So all we have to do is pretty much just diagnose you and treat you. There you go, and basically you get everything that you need. Perfect. Susan Garcia, okay, so you are actually having a heart failure, and you have fat malabsorption. What is that? That needs some PERT, but what is that actually? Fat is imperfectly absorbed from the small intestine. That's tough. Anyway, so since you are in the hospital, obviously you need the defibrillation analgesics. And let's give you some PERT as well for now. Okay. But the most important thing, you right now have to get your defibrillation. So I'm actually, let me just keep it here. Hold on. You see, this is what I don't like. Everything, they keep showing me everybody. Okay, so I keep you there. And let's go to Charles Rodriguez. You already give you some analgesics, some pain medicine, and not everything. We haven't done everything. So ECG we have done. Abdominal palpation we haven't done, but that would just give you some rest, and you're getting that. I'm not gonna do urine analysis. That's not important for you, and we cannot do anything. So you just basically sleep on, my friend. Peter Taylor. You have calculus of ureter, shockwave leap. Okay, you need the. Okay, hold on. You do need the analgesics here. Why? You've been waiting for that for a long time, so you are really unhappy. That's for sure. So he has cloudy urine. Yeah. What do you know? What do you do with that? Oh, you're already giving him rehydration, so that's fine. You have to have that. Where do you have it? General surgery department. Yes, and sonography unit. Okay, so you have to have that. Why aren't you having it yet? I'm already scheduled it for you. And we know everything else about you, so I'm gonna keep, as I said, the hospital patients, I keep watching them all the way. Now, let's actually see anything else. Analgesics, you get it. Antibiotics, let's give you. Nothing here. There you go. So you should be all fine, my friend. Just hopefully there are enough doctors that take care of you and give you what you need. Okay, retina scarring. In the meantime, how are you doing, sir? No, where is the one? This is the one. No. Who is the one who got... See? I'm getting confused sometimes. Anyway, this woman here, okay, you already know what exactly the problem is with you. Corticosteroids, you don't even need to go to the, you don't have to be in the hospital for that. Susan Barkley is just going to take care of you. Okay, so far so good. Okay, now this is bad. She's got a lot of possibilities. We don't know what her problem is. Apparently, thorax percussion would kind of show a lot of things, but she already did it. All right. Let's actually help her a little bit first. Bronchodilators. I want her to feel better. Cough suppressor? No, we don't need it. She's not coughing that bad right now. But let's try to figure out what's wrong with her. And let's try to get some very dangerous stuffs out of the way. I believe she already got ECG. Yes, she did. She already got blood pressure management, blood pressure testing. Hold on. Did she have an echo? She got an urgent echo. That's good. I'm just looking for anything that is red. Anything can get her basically a big problem. Angiography. Okay, I think we need to do an angiography here, unless... No, we haven't done that yet. Okay, so that's one thing. Temperature. We already checked your temperature, right? Yes. CRP, we definitely checked that. Now, of course, there are two things here. One is trying to find out what's wrong with you. In other words, what separates you from everybody else, And at the same time, that's not a lot, not a lot of things we can do actually. We already are doing this. We haven't got the results yet. An MRI, X-ray chest, biopsy. This could be actually a very. I had a. Oh, we are doing the biopsy. Okay, because there was a patient that actually died because of that. He didn't. She didn't get that. So that's good. So we have CT, MRI could show different things. Physical, PCR, blood test. I'm pretty sure that we have done blood test before. Spirometry. You could only do that in the internal, but I don't think it's a big deal. Big deal. I think I'm gonna do an X-ray chest first, and let's see where it goes. Okay, Margaret Foster is a specialist. I'm happy for you, but I don't really care. Okay, hold on. Somebody here is in trouble. Robert Clark. She's collapsing. Oh, we already. Wait a minute. This is the one that was in trouble. So she is, or he is already getting the defibrillation and everything, so he should be fine. Who else? Anybody else? Oh, Rachel. Oh, there are actually a couple of people. Rachel. She is actually going to the room. And Susan Garcia is actually collapsing, but also, I believe, getting whatever is necessary, so never mind. So let's go to Sarah Baker. Let's just take it one at a time. Okay, she finished, and basically she can go home. Yeah, let's go home. Go home. 1,100. Nice, and we have one less patient. That's awesome. Patricia Lewis, you got a flared chest, which is kind of scary. You are hospitalized already, so all you have to do is really get the diagnosis, get that, and then you're good. Okay. Scoliosis. Okay, that's a simple thing. All you have to do is give some exercise, whatever. Mary Jones is gonna. Oh wait, it's hospitalized, so no, we're gonna keep it. Sorry. We're just gonna give you some exercise and what else? Analgesics. NSAIDs. Do we need numbness? No need. All right. I might have accidentally got rid of the control of a couple of hospital patients. I'm not sure. If I do that, scream at me, please. Scheduled procedures have finished. Last was physical. Are you serious? He had all these things, and the last thing that we did was physical. That is kind of funny. I'm sorry to say that. Anyway, what else can we do about you? Nothing really. We already know that no need for thorax percussion. So everything else here. Tranquilizers, I don't think that, speech listening we did. Temperature, we did everything. So what do you need for that? IV antibiotics, and she is getting that. Anything that you have weakness, vomiting is actually a medium, so let's give him stomatics. No need for tranquilizers. All right, you just sleep. You're good. Fraser Wilson, you have pain. And you already have 2 pages of stuff and we don't know anything about you other than that. Okay, so you are in the clinic actually, and I think maybe this is the time that we should actually put you into observation. Well, you have a lot of possibilities, and you came to the cardiology, but as you can see, the least likely that you have a cardiology problem. But why don't we really work that out? Hold on. And geography, you had an ECG already. Because you are here in the heart department, so I'm gonna give you an angiography. Okay, that's why you're in the cardiology department, right? If everything is okay, then I'm gonna probably have to send you to a different department because you are just wasting our time here. Okay, I cannot even read that. Lab procedure uncovered a new symptom of a favorite patient, Streptococcus pneumoniae, which I have no idea what it is. Let's see. Actually, the IV antibiotics are taking care of it. You are treated. So what do you want from me here? Basically, that's okay. That is already been taken care of by the IV antibiotics. So just keep sleeping. Brooke Robinson. Okay, you are weak. Well, you're 75. What do you want? Um, Sorry. I would definitely start with the physical. Let's do chest. Let's do a speech listening. And the temperature. Okay? We're gonna check a couple of things about you. She's basically a clinic patient, so I'm gonna treat her as just a normal clinic patient. I don't have to worry about her. Okay, Karen Cole, you're back here. What do you want? You get everything already. Oh, you just got your stomatics, finally got it. You got the stomatics, so you're feeling better. I'm happy for you, but just sleep. Susan Garcia. Okay, so at least they fixed her. You know, she got defibrillation, so she's better now, I believe, but we still don't know which one is it. Now, let's see if we can do a differential. 0%. I doubt. Let's see if there is any other doctor can do a better job here. Yeah, actually, this is the problem. Nobody has a differential diagnosis ability. Only she does 0%, literally. I'm not sure that's enough. So actually, I'm thinking we should take a look at these people and maybe somebody has to be transferred, you know, like has to be trained, cross-trained a little bit to something else. Anyway, since you, well, you know what? You have 0%, but 0% is better than nothing according to the game. So let's do a differential diagnosis. I'm probably going to end up with nothing basically, but that's okay. Rachel Ruiz, okay, you are hospitalized and sleeping, and the urgent echo didn't do anything for you. Okay, you still have a ton of problems here. Have you checked your temperature at all? Yes. Um, CRP, ECG, we did. Like actually, you know what? My son went to the ER a couple of times, not just him, but you know, and I realized that every time we went to the ER, they definitely did an X-ray, an ECG, and a blood test. Like, even if you go there that, hey, I broke my teeth, I believe they would do that. So apparently this is like a standard that shows off maybe most of the problems that somebody can have. It looks like it. So it seems to be a very, very useful stuff to do. Okay, when it comes to finding, different things, there are so many different things that could be. Let's try to do something simpler one. But we really did everything that is just simple. A USG, I don't know what a USG would do, but I'm gonna do, since you are in hospital, I am going to do a CBC. I'm gonna do a serologic and a microbiome sampling. Okay? All right. Where are you? Okay, Frank Gonzalez. What do you have? Could be anything. You have severe arm pain. Okay, definitely do a physical. And let's take it from there, I guess. Yeah, let's do a physical. Okay, that's gonna be like obvious you have to have first. Okay, producers have finished. You are in the hospital also. You have open fracture, complicated. Okay, so it's all orthopedic actually. But first we have to do something with you. Okay, so bandage. Okay, we definitely have to have an emergency care. Okay, we have to stop that and let's give you some pain medicine first. And at the same time, let's do a physical. Okay? Hopefully that's gonna be giving you all what you need. Robert Clark. Okay, your heart failure is fixed. Finally, that's good. We're gonna give you some bronchodilators. Okay, because you cannot breathe. That's not really a good thing, but we still need to find out what the heck is wrong with you. And there are a ton of possibilities here. Okay, I'm definitely going to do an ECG because that's always a big danger that you have some stuff and ECG and yeah, ECG seems to be the first one that we really need to do. Maybe an angiography. Could be a USG. Okay, let's see. Is there anything simple stuff that we could do first? A Let's do USG, that's quick, okay? And you can do it, I believe, I don't know where you have to do it, maybe in some other place, but let's see. Go to. Okay, so you have three different possibilities, ma'am. Two of them are internal medicine, and one of them is a general hospital problem. We did check your temperature, we did check your speech, we did just chest auscultation. We haven't done thorax percussion. Let's do that. Do we need a neck palpation? Let's actually check your CRP. That's very quick and in the office. And as I said, let's do an ECG because apparently everyone, they do that. So We're gonna plug up again the ECG. So cardiography units. We have to have more cardiography units built up, I believe, but that's okay. All right. Okay, we already know what your problem is. That's great by the physical. That really worked out. Okay, so we don't need any more exam, but let's see what else do we need. Physical, we did that. Yeah, then we don't need anything else. You just simply need burn management, and that is Frank Williams, the doctor, is gonna give you with no problem. Okay, so we're gonna have another patient getting out of our care in just a second. That's good. Let's see how many patients we have right now. We have 63 people in the hospital and 9 in the clinic. That's a lot of people. All right, so Susan Garcia. Okay, we know exactly what your problem is, and you are already getting what you need for it. So what else can I do? Really, you are in a hospital though, so since you're already there, why don't we give you everything and just... We definitely don't need to go to ICU. You should be able to go to just normal. Actually, you know what? Let's send you over. I don't want you to clog up my, what is it? My TC. So please go over to General, and please go over to, oh, I cannot. It's gonna put you to HDU. Okay, I didn't want that, but that's fine. All right. Lisa King. I cannot even change that. Lisa King, you have endocarditis, which you need the IV antibiotics for. You're good. Judy Taylor. Okay. We are doing LS tests and blood tests. Nothing, right now, nothing actually shows. We did a blood draw. It didn't show anything. Well, blood draw won't show anything. It's a blood test that shows anything. So I think really nothing there we can do right now. I think we have to just let her... Should we do some like stool collecting or anything? I don't think so. I think she's fine. Want to make sure that if there is anything that would be urgent, we do it. We already did the angiography and stuff, right? That's weird. No, echo. We already did an echo, right? Yeah, we did the echo already. Anything that could be really dangerous, we already did, I think. So yeah, we should be fine. Just sleep. Okay, Christopher Wilson. You are basically... Everything is okay, other than, of course, you still have a lot of things that you might need. Chest pain, you need some pain medicine. I don't know why you haven't got all these. It's probably still from when I wasn't controlling everything. You don't need that. You don't need that. Stomatics you should get. That's pretty much it. And you already having the IV antibiotics that is taking care of the thing that you found, and everything else is fixed. So you're good. Casey Green. Okay. Obvious. Oh no. Sarah Miller cannot even do a differential. So we definitely need an X-ray here. Thank you. Having said that, hold on. Can't we just do a bandage first? Jordan Harris. Okay, now that's... Let's see what we should do. Let's first, why don't we first, I mean, we already know what your problem is. How many patients are in, hold on, let's see. This should go over to internal medicine. Where is the internal medicine hospital? Hospital, hold on. Internal medicine is, I believe, on the 3rd floor. There you go. Oh, you have a ton of places. No worries. So, you, sir, basically go to the internal medicine. You're gonna go there. You're gonna get some. First of all, you can have some regular, right? Yeah, regular hospitalization. You're gonna get your IV. Is it? IV antibiotics, yeah, for sure. Chest pain, you're gonna get some pain medicine. Breathing problem, you should get some bronchodilators. Sore throat, no need. Get you some NSAIDs. All right, so you get all these, okay, and then we're gonna take care of, let's actually check if you have a temperature, fever. We don't need that, you already, oh no, wait a minute, let's do a chest auscultation as well. We haven't done a physical at all. You know, let's do a physical. And we still have to do a couple of other things here, which is very important. Let's do an ECG and an MRI. Okay, so basically, I already done everything that he needs. Okay, so they're gonna take him over and he's gonna be busy as hell. Okay, long wait for treatment. All right, let's see. Linda Johnson, he's waiting. Oh, it is an appendicitis, which is actually very urgent something. Okay, so let's take a look at. He is scheduled. He's supposed to be scheduled already. Why isn't he? Why isn't she, I mean? Where is the general surgery? I think it was. Oh, it wasn't this one? Sorry. Oh, because I was looking at the wrong floor. Okay. So right now in general surgery, who is this guy? He is having a laparoscopic surgery right now. Okay, I got it. And how many people do we have another team here that could actually take care of it at night? I don't think so. I think we only have one set of people that could take care of things, right? So what I'm gonna do is actually I'm gonna have some night people. Okay. Let's actually see. Yeah, nighttime. Let's have another set of people. So let's do one surgeon. Okay, this one is brilliant. We're gonna have that. We're gonna have one. We need one anesthesiologist. That would be okay, but let's see what is your problem. Oh, you don't have any problem. Perfect. Welcome on board. And let's see what else we need. I think we should need, I think we have enough doctors. But let's get one more doctor just in case. Okay, this one, and for you, sir, you can only do assisted surgery, nothing else. Okay? You kind of suck, but that's your job. All right. And then let's see if she is going to be treated soon, hopefully. Oh, wait. What I forgot to do is all these new people that I just got, they have to be specialized. So anesthesiology, you can only do that. Okay. And who was the other one? Was this the guy? No. You are the only one. You can only do surgery. Okay? Now you should be fine. All right. Susan Garcia, she's got her stool analysis and it came out nothing. That's fine. Serologic testing is going on. Let me see. She's already got the EC. Yeah, she already got everything. Literally, there is nothing we can do about her. She just needs to... you know what? Let's give her everything here and just sleep. And I think, guys, we are more or less done today. I have to go a little bit earlier to work, so I'm gonna finish it roughly here. This person got everything that she needed. Yeah, I'm not gonna give her. So we basically, so far we are doing good. It's 2:47 a.m. here. We haven't got any major problems so far, at least. And I think everybody's been treated well. We have 11 people already treated, and we don't have any danger so far of like somebody's dying or anything. Anyway, thank you so much for coming. If you like what you see, please hit the like button and leave me a comment below if you like which kind of playing you like in this game. Do you prefer this kind when we are going through and every single, we are treating everything and finding out treatments and everything, or you prefer the way I ran it the previous few days, well, previous few days in the hospital, I mean, when basically everything went automatic as a simulator, basically, just let it run, but, you know, trying to figure out where we need a little tweaking here, a little tweaking there. Which one do you prefer? So, night is going okay. That's the safe game. So leave me a comment below on that, and of course about anything else that you feel like saying. And I'm gonna see you guys very soon. Thank you for coming. Bye bye.